drug administration, right? The pharmacology here. So what is the drug administration? First of all, we have to know. So drug administration means this is the process of giving out the medication to the patient in order to treat or prevent the disease or complication. So drug administration, the definition of it, this is the process of giving out the medication to the patient in order to treatment or prevention of the disease or prevention the complication, right? When you give the medication or a drugs is very or any substance that alter our physiological function with the potential for affecting the health. So every drugs has an effect, and this is called therapeutic effect. So I said a medication is a drug, or a medication is a drug administered for therapeutic effect. So we eat the medication to get something good. It is called therapeutic effect. So when you give the medication to the patient, because we are LPN, we are RN, we have to give the medication to the patient according to the doctor orders. So when you give this medication, we have to follow the 10 rights of drug administration. Some books said 10 rights, and some book wrote 6 rights. Okay, 6 rights. So check the 10 rights or 6 rights. It's called 6 rights of drug administration. Some books said 10 rights of drug administration. So we have to check these 6 or 10 rights. What they are basically means you have, before to give this medication to your patient, you have to check the right drugs, right patient, right doses, right route, right time and frequency, and documentation. Also, right history and health assessment, drug approach of the right to refuse. So patient, if patient want, they can refuse the medication. Or we have to know the drug and drug interaction and evaluation. And education also, it is very important. As a LPN or as a RN, you have to know the education and information about the drugs, what you are going to give your patient, right? Let me read this PowerPoint with you. Preparation for the drug administration. So first of all, we have to check the rights. Some books said 6 rights. Some books said 10 rights, right? Whatever it is, we have to check the rights for the patient regarding drug administration. The standard precursor we have to follow, like hand washing, hand hygiene. Double check if unsure about anything. Like the patient has a hypertension, but the doctor prescribed the medication, it is totally new to you. If you are not used to with that medication, if you do not know the information about this medicine, you have to hold it make a phone call to the doctor office, ask what it is, read it, ask his co-worker, then sure that it is everything is okay. Double check if unsure about the medication. Definitely, it is very important. Check the drug allergies. How you have to know that? Simply ask your patient any past medical history about the particular medicine or medication, any kind of allergic reaction. If they say yes, you have to hold it and prepare the drugs for one patient at a time. Prepare drugs for one patient at a time. So don't do this. Two medication you make for two patients at the same time, or don't like your co-worker say, okay, I make this medication, you can give it to your patient. Don't do this. It is your duties, it is your responsibilities, it is your accountabilities. Check the label 3 times, say, and use verify medication record. So if you see your patient has any kind of allergic reaction or any drug interaction, right, we has to stop it. So it is very important when you give the medication, you have to have a very clear ideas about the medication. Even what medication, what route we have to give, it is also important, right? Check the expire date. Definitely, if it is expired, you do not give it to your patient. Check for compatibilities. Check for the patient identification. NCLEX board asks a question. How you have to identify your patient, right? How have to identify. So if patient said their name, you don't rely on, you do not depends on it. So better you have to check the patient birth rate, their date of birth, right? Room number is not a way to identify the patient. So when in any when you work in the hospital or any clinical setting, it is always important to identify because there are so many patients. So sometimes we do wrong to identify who the patient and who with whom I have to give this medication, right? So basically for identification, we use the patient bracelet or we use the date of birth. So give the medication on time. Yes. Appropriate doses, appropriate route, and same time every day. So explain the medication to the patient. So as an example, I said, like you are going to give the patient diazepam. So after the diazepam, patient feel drowsiness. So if you tell it before, they will be aware about the side effect, and it would be easy for them to coping mechanism, right? Otherwise, they can be panic, dizziness. Explain the medication of the patient, educate them, reinforce them, open medication at the bedside. Yes, very important. document the medication given before giving to the next patient. When you're done and give the patient, just right away, keep a documentation, then go for the next patient. A good documentation can save for your patient, it is safe for you, it is safe for your license. So I believe you don't want to lose your license. So it is good to go in the systemic way. So now we said the oral medication always assess for swallowing. We never crushed out, we never broken it. Sublingual or buccal medication. So some of the medication we give sublingually, like the so some of the medication we have to give orally, some of medication sublingual or buccal, right? Orally distinguish medication, some of them liquid, some oral medication to infant or children, drugs given through a nasogastric tube sometime, or rectal medication. So basically, this is the step-by-step or different route of medication. If I explain according to my way, I want to say the route is categorized by two. One is called local, other is called systemic, right? Local means if you give some ointment or cream to the subcutaneous tissue, right? It's local. Anesthesia, sometimes we use as a local. So systemics means, again, systemic is categorized by two, is called enteral or parental. Enteral means when you give the medication orally, sublingually, or rectally, it's called enteral. And parental means if you give the medication injection, inhalation, or transdermal. This is called parental, right? So I am saying we use the medication oral route, sublingual route or buccal route, rectal route, topical route, transdermal route, inhalation route, or injectable route, right? Different route for different kind of medication we use. Like example, sublingually, here, basically sublingually, most popular medication we use nitroglycerin, right? Nitroglycerin for angina or angina pectoris. So when we give the orally or sublingually, or we give the medication in our cheek or in the gingival or palate, all is basically orally. Sublingual delivery, if I say it, means the floor of the mouth. So this picture, you can see the medication on the floor of the mouth, right? Floor of the mouth is called sublingually. Sometimes you can say the buccal delivery, means the lining of the cheek, right? And also the local delivery, like sometimes we use the medication on the cavity or on the ulcer, like fungal condition, we use in the local, it's called local. So It's called sublingual. In the picture, you can see the tablet nitroglycerin give in the sublingually. If you ask what are the advantages of sublingual medication, the advantage, this route can easily absorb the medication than the other way. It is easily absorbed, I said. So, and also why it is easily absorbed? Because there's so many blood vessels just under the tongue, and the medication directly go through the circulation, right? So it's called bypass the hepatic metabolism. So if the patient has the angina or angina pectoris or MI at the home, we give sublingual nitroglycerin or GTN. The advantage of this easily to bypass the hepatic system and quick termination, first pass avoided, or drug absorption will be quicker. But there's some disadvantage as well if you give the sublingual, like unpalatable or bitter taste sometime. If the drug is bitter taste, patient feel discomfort, unpalatable. Irritation, oral mucosa, okay? And large quantity is not possible to give. Also, few drugs are absorbed. So what next? So parental drugs, what I tell you before, the medication, basically we can give locally or systemic, right? The systemic one, again, divided into enteral and parental. Parental may be injectable, inhalation, or transdermal, right? It is called parental. So here they said never recap a used needle if you give the parental route, okay? Or the may recap can unused needle with the scope method and prevent of needle stick, and also filter needed. Like injectable, it is the parental, right? Intramuscular, intradermal, intravenous, intraarterial. So here always we have to use the new needle, not recap it. So here it is showing the needle. We can see filter needle. It is better one-time use, not reuse it is, because this simple needle can transmit so many dangerous diseases like HIV, sexual infection, so many disease, blood-borne disease can transmitted by this needle, hepatitis, commonly transmitted. So what next? What are the basic information we have to know for parental drugs? Like removing the medication from ampoule, or removing the medication from vial. So vial and ampoule, basically the vial is a small bottle and ampoule is a small cylinder-like bottle. Usually the ampoule contain the liquid watery form medication and vial contain the powder medication. The safe disposal of used needle is very important to prevent the contamination, right? injection. Some of the medication we give as an injectable form. So what we have to do when medication, we have to give the injection route. So injection route or injection, this is the second commonest route for the drug administration, and they mainly involve introducing the drugs in the form of solution or suspension into the body at various sites, and also varying the depth using the syringe and needle. And thus, the administration involves the risks of infection, pain, or local irritation, right? So the needle angle for the various injection, we have to follow different angle for different form of injection, like intramuscular, shortly called IM. Sub-Q is called subcut, and intradermal ID. Also, we have to follow the airlock technique to avoid ear embolism. In this picture, beautiful way to explain different injection, like this is a 90-degree, is called intradermal. So intradermal injection, the needle should be 90 degrees. 45-degree basically subcutaneous. Sub-Q is a 45 degrees basically, and intradermal 15 degrees. Subcutaneous basically insulin we give subcutaneously, heparin subcutaneously, pethidine intramuscular, right? And some of the medication we give intradermally. So in this, please have a look on this picture. At this picture, this is the layer of the skin from out to inside. Outer layer skin, and skin have definitely epidermis, dermis layer, right? Then subcutaneous tissue, and finally muscle. So the outer layer of the skin contains epidermis and dermis layer, and then subcutaneous tissue. So intramuscular, if I said the needle for intramuscular, how many structure cut? They can cut epidermis, dermis, subcutaneous tissue, and finally enter to the muscle. This is the question NCLEX board asks. Subcutaneous injection, how many structure cut and what are the angle of the needle to the skin? 45-degree angle. They cut the epidermis, dermis up to subcutaneous tissue because the medication delivered in subcutaneous tissue. Intradermal. So intradermal tissue only cut epidermis, dermis, right? And the medication delivered in the dermal layer, right? So injection route of drugs administration are usually employed where the rapid effect is urgently needed. Injection we give if patient need immediate effect, urgent effect. Like heparin and warfarin, both are anticoagulant, blood thinner, but heparin we use for urgently by injectable form. But warfarin or coumadin we give orally when patients are stable and they need slow releasing medication. The patient is too, if the patient is too sick or ill or unconscious for oral route, we give injectable form. If the drugs is orally ineffective due to its being destroyed or not absorbed from the gut, we give injectable form. An injection is only way for the drugs to reach its required site for action, right? And there is need to maintain a steady blood level of a drugs. Important, right? And here I said I want to recap something. It is very important for NCLEX board, like subcutaneous, shortly called SC, and subcutaneous 45 degrees frequently used, the angle, administration just below the skin or hypodermis, intramuscular admin into the muscle, medication delivered into the muscle, intradermal admin or administration medication up to or into the dermis layer. Yeah, sometimes we use intravenous IV, so administration within or into the vein or veins. Intra-arterials means medication we give into the arteries, right? So what else? What next? So next is called intradermal and subcu. And subcutaneous injection, mainly we give insulin administration and heparin administration. This is two most popular medication we give subcutaneously, right? So here we go. Next example, let me show. Always use an insulin syringe to admin the insulin. It is most commonly asking question in NCLEX board. For the insulin who have the diabetes, especially type 1 or type 2, what are the not controllable by oral hypoglycemic agent, we can give the insulin, right? For insulin, we use a special needle, and this is called insulin syringe. This is the small one, 1 ml. The type of insulin syringe, 100 unit or 50 units, right? Shortly called U100 or U50. The patient can self-administration of insulin because of this small needle. And they can also carry with them traveling. It is easy for them to carry out with them, and they can easily take care of it. And I said it is easy for the transportation. It is easy for the patient who give the insulin by themselves. And here we go, the intramuscular injection, intramuscular we said. So intramuscular, this is the another route of medication administration, right? Intramuscular. So sometimes it's called ventrogluteal site or vastus lateralis site, deltoid site, and dorsogluteal side as well. So this picture, you can see the different injection site. Most common site we use for deltoid site, right? Deltoid muscle. And here another muscle is called ventrogluteal site. If any adult person or after the age of 6, the most common site is called deltoid site for intramuscular injection, right? But if the patient before, or I said children, we use the vastus lateralis side. This is the muscle is called vastus lateralis. It is the preferred site for pediatrics injection. Pediatrics. Pediatrics. But I said the NCLEX board asks a question in case of the children or baby infant, what are the site we use for intramuscular injection? Vastus lateralis. For the adult, we use the deltoid site. What are the other site? Is called dorsogluteal site, right? So intramuscular injection we give ventrogluteal. The picture this is called ventrogluteal site. This is dorsogluteal site. Vastus lateralis site. This is called vastus lateralis for children, pediatrics. The muscle name is vastus lateralis. And deltoid site and dorsogluteal site as well. This is deltoid site, this is dorsogluteal site, this is ventrogluteal site. Intramuscular injection, basically we use zigzag track or Z-tag technique. Sometimes NCLEX board asks intramuscular like iron injection. Most common we give for iron deficiency anemia. And iron deficiency anemia is the most common anemia among the other categories anemia like pernicious anemia, aplastic anemia. So, but most common one is iron deficiency anemia, right? So, iron deficiency anemia, the injection we give is called Z-tag techniques, basically. So here the picture again, I recap it. I explained it a few minutes ago. The subcutaneous injection site, most commonly we use around the umbilicals, right? So if you give today injection with subcutaneous injection means insulin injection, you have to give every day or before your lunch or dinner. So if you give the injection today left side, tomorrow you have to give the right side, alternative side, to avoid the lipodystrophy. So we have to rotate the side to avoid the lipodystrophy. And NCLEX board frequently asks this question. What are the other side of sub-Q injection? Sometimes we can give over the anterior aspect of thigh, or we can give the scapular area, even the back muscle. But most frequently, most commonly, we use the abdominal around the umbilical area. In this picture showing in 90-degree intramuscular IM always needle should be 90 degree to the skin, and medicine delivered to the muscle. And sub-Q, it is 45 degree to the skin, and medication delivered to subcutaneous tissue. How many structure cut? It is another question NCLEX board asks. And intradermal, it is medication delivered to the dermal layer, outer layers, epidermis and dermis, and 15 degrees. Sometimes NCLEX would ask what are the length of needle of every injection, intramuscular, subcutaneous, intravenous, or intradermal. What next? So here we're showing when you give the injection, how you have to place, right? This is the site of injection, and it is called anterior superior iliac spine. This is the bony area. It is called iliac spine. It is tuberosity, and this is called iliac crest. So you see, wear a gloves, hand hygiene, wear a gloves to prevent the infection, and put it here. And this is the in between two finger, right? Middle and ring finger. Then we give it to the medication. Intravenous medication like needleless system, compatibility issues, expiration date, we have to check before to give this medication. We have to check the needle length, compatibilities, expired date, infusion of intravenous piggy bag. We should put it in the place before to start. And also we have to labeling the intravenous infusion bag, right? It is important what type of pen you should use during the writing, right? So intravenous medication, avoiding the medication to a primary infusion bag, or IV push medication like is called bolus, through the IV lock, and also through an existing IV infusion. IV infusion means intravenous, so medication delivered to venous. So this is the picture you can see. This is called T-stent, right? And this is saline solution bag. It is piggy bag, right? So, and another one means this is the saline for continuation the channel, and this is the medication, maybe any antibiotic, any chemotherapies. So you can see this is the linked up, right, in the main channel. So sometimes mathematical question come, how many drops have to go per minute? We have to adjust by a regulator here. So before to arrange the IV or intramuscular, we have to gather all of the materials before, then go and then start the system. Intravenous medication, volume control administration set, using electronic infusion pump. So, and also patient control analgesia. So if the patient has a pain, you can use the patient control analgesia pump. Everything you set it up, but patient can push the button when they need, right? So this picture, you can see this one is called patient control analgesia. And this man, I mean, patient or client have a button. When they feel, they can push it and medication will release, right? And sometimes we use the electronic infusion pump. So you do not need to count down. The automatic device can do this. Volume control admission set as well. So tropical drugs, what we basically use for our patient, like eye medication, here tropical only use. Eye, like drops or ointment, ear drops is for the adult, or we can use for infant or child younger than 3 years of age. So when we give the ear drops, right, ear drops administration, especially for the adult or children, it is very important. We have to know some information for the student, okay? Because NCLEX board asks this question. When you give the ear drops for adult, always pull the ear back and up for adult, right? Let me explain. Let me recap it. When you give the ear drop for adult, pull the ear back and up. But when you give the ear drop for children, pull the ear back and down for a child under 3 years old. So in this picture, we can see when we give the ear drop for adult, we has to pull the ear back and up. Pull the ear back and up for adult. What about the children? Pull the ear down and back for infant or children who under the 3 years old. Easy way to remember, in case of children or child, C-H-I-L-D, D for down. So ear is back and down. In case of adult, A-D-U-L-T, U means up. Pull the ear back and up, like this picture, right? NCLEX board asks this question frequently. In this picture showing how to put the eye drops. Basically, one drops is more than enough at a time for one eye. Tropical drugs, others called inhaled drugs, right? Inhalation. So another also called administration of medication to the skin, right? So here, inhaled medication, basically we use for metered dose inhaler, like if the patient has a bronchial asthma, we use the salbutamol or albutamol, or sometimes steroid. We use the metered doses inhaler or evohaler, right? This is called inhaled medication. This is the example of tropical route. So tropical drugs or route, drugs are applied tropically. That is to the skin or mucous membrane of the ear mucous membrane of the ear, eye, nose, mouth, or any other local tissue for local function, right? The tropical drugs or route provide a high local concentration of the drugs without affecting the general circulation. However, drugs that are absorbed into the circulation after local administration may then have a systemic effect. Drugs for tropical application are usually available as a cream or ointment, right? Or drops, I said. So inhalation route, basically we use for the medication for lungs, right? So it is called, sometimes it's called pulmonary route, inhale route. So the drugs we use sometimes metered dose inhaler or evohaler, drug powder inhaler, or small volume nebulizer. So drugs delivery by inhalation is a common route both for local or systemic action. This delivery route is particularly useful for direct treatment of asthmatic problem. If patient has a bronchial asthma or COPD, bronchitis, we use this route, right? So using both powder aerosol, powder inhaler, right? Like salmeterol, salbutamol, or pressurized metered dose. It is called metered dose. Aerosol containing the drugs in liquid form, right? Like salbutamol sulfate inhaler. Basically, the drugs may be inhaled as a gas form, like nitrogen oxide, and also enter the bloodstream by diffusing across the alveolar membrane, right? And this is the method of administration of volatile anesthesia, such as either halothane or methoxyfluoride. Sometimes we use. And also it is important, the lungs provide an excellent surface for absorption when the drugs is delivered in a gaseous form or aerosol form. And this result is a rapid onset of action. Another advantage of that way to deliver the medication that the plasma concentration can be rapidly adjusted as well, right? So administration of medication to the skin, basically we use different lotion, cream, ointment, or powder. Also transdermal patches, right? Transdermal patch, here I said transdermal patch, here what it is. Transdermal route is commonly referred to as a patch because the medication is contained in a patch that is absorbed through the skin, and drug administered through this route must be highly lipophilic. And absorption via this route is slow, but conduct conducive to producing long-lasting effect. And special slow-release materials or drugs in some transdermal patch can maintain steady drugs concentration that approach those constant IV infusion. And transdermal patch also provide less absorption problem in the gastrointestinal tract. This is the advantage, right? And that are commonly experienced by the patient who take the oral medication. Sometimes NCLEX board, what are the drugs usually we use as a transdermal patch? The drugs administration through this route include fentanyl patch for severe pain management, or nitroglycerin transdermal patch we use to prevent episode of angina in the people who have a coronary artery disease. Also, we use the nicotine patch for sedation of the smoking. There are three information we have to know for NCLEX board. For transdermal patch, we use for pain management is called fentanyl patch. Nitroglycerin transdermal patch we use for episode of angina who have coronary artery disease. Another question NCLEX board sometimes asks for smoking. If you want to stop the smoking or cessation of smoking, we use the nicotine patch. Next, another topical drugs we use for nasal drugs is called drops or different spray. If the patient has an allergic rhinitis, antihistamine is not enough, you prescribe steroid. So steroids nasal spray sometimes stop the allergic rhinitis, or nasal decongestant we use as a drop or spray, right? Another topical drugs we use is called, it is used by vaginal route. It's called vaginal medication, like creams, foams, gel, or suppositories. It depends upon what are the medical condition, or we have to follow the healthcare provider prescription.